Okay, so new heart models. You've got right and left auricle. You know left is always the same side as the descending thoracic aorta. So if we open up the auricles, you're going to have right and left atrium, and of course your two lower chambers, right and left ventricle. They are separated by this wall of muscle here, interventricular septum, and then right here, the little wall that is between the atria is your interatrial septum. Inside the right atrium, you have this little indentational area right here, which is the foramen ovale. And then this upper area where the superior vena cava is draining into, and of course then you see your inferior vena cava right down here. This area as a whole is called your coronary sinus. Muscle in the walls of the atrium is called your pectinate muscle. Muscles in the walls of the ventricle are called your trabeculae carneae. Right here, we can see one of our atrioventricular valves. Of course, this would be the right atrioventricular valve. The little tentacles, if you will, of the valve are called the chordae tendineae, and they are anchored in place by these big bulbs of muscle here, which are called the papillary muscle. So trabeculae carneae and papillary muscle only associated with the ventricles. We move over to the left side. Here we've got our left atrioventricular valve with the chordae tendineae. This valve formerly known as the mitral or bicuspid valve. And then behind it, if we can get a good picture, there's a valve right back here. That's your aortic semilunar valve. And on the right side, you see the pulmonary semilunar valve. That is leading from the right ventricle into the pulmonary trunk, which is located here. So I'm just gonna put this back together. Bottom rounded portion of the heart is the apex. Top portion of the heart is the base. Again, here's that pulmonary trunk, which splits to become your left and right pulmonary artery. So notice that they're blue because their arteries are taking blood away from the heart, but they are going to the lungs to pick up oxygen. So pulmonary artery. These guys right below it are my right and left. These are my left superior and inferior pulmonary vein. Here would be my right superior and inferior pulmonary vein. Coming up to the aorta here, and again, that's the superior vena cava. Here's the ascending aorta, arch of the aorta, and again, coming down, descending thoracic aorta. Branches off the top of the aorta, you've got, starting at the right-hand side, brachiocephalic trunk, left common carotid, left subclavian. Eventually, the brachiocephalic trunk will split into the right common carotid and the right subclavian. That should be all of your structures for the heart, other than outer covering around the heart is called the epicardium. Anything that looks like middle muscular layer of the heart, so like here, this would be myocardium, and the muscle lining, the lining that lines any of the chambers, that's called endocardium.